Experts at UK call the influx of illicit fentanyl combined with the COVID-19 shutdown a perfect storm, resulting in a 49% spike in the number of drug overdose deaths in Kentucky. Now, as reporter Samantha Valentino shows us, a team of researchers is taking a closer look at that increase.
During the pandemic, Kentucky saw one of the nation's largest increases in drug overdose deaths.
We know now that that was largely driven by fentanyl.
Dr. Rachel Vickers-Smith and a team of researchers at UK are working to better understand this spike.
What we want to know is, did the COVID pandemic, have an effect on the influx of fentanyl we saw in the illicit drug supply, which then impacted the number of overdoses that we saw.
The study is still in its early stages. Researchers will be collecting data over the course of several months. That will include interviews with law enforcement, harm reduction specialists, and people who sell and or use illicit drugs.
We want to hear their perspectives. You know, people who use drugs are experts of their own experience. And so in order to create impactful and sustainable changes, they need to be at the table and in the conversation.
This study not only looks at how this spike happened, but also what Kentucky can do should similar conditions happen again.
What we're hoping is that we can learn from this strategies to keep people safe so that we're prepared, because this will happen again. Maybe not to the level of a global pandemic, but the drug supply does change and will continue to change in the future. So we need to be ready for it.
This study will also look at what drug users do to keep themselves from experiencing harmful effects such as overdose, as well as explore their attitudes towards different potential harm reduction strategies.
This study is funded by the National Institute on Drug Abuse.